So I've travelled around and we're now in Port Macquarie in New South Wales, a beautiful coastal town.
Well, my name is Caree Alexander. I trained as a dentist at Melbourne University, graduated back in 1985 and practiced in the Navy. Then I was in private practice for about 20 years. I moved here to Port Macquarie about 3 years ago and put down my dental tools to enjoy a bit of a different lifestyle, a different pace. And my partner and I now run an environmental products store. We sell all over Australia. So yeah, that's a bit of a change from dentistry.
Dr. Alexander, are most other dentists you know aware that water fluoridation chemicals are actually industrial grade waste products?
Well, from my personal research, I would say the majority of them are not aware. A lot of them do know, and they do know what it is, but they still believe somehow that the government is right in doing what it's doing, and they believe that they're doing citizens a favour by supporting water fluoridation. However, when I graduated from university, we weren't given any information about where it came from. We all assumed it was calcium fluoride. We would have thought they wouldn't have put anything else other than pharmaceutical grade fluoride into the water. Then the ADA was very good at covering up what the actual chemicals being used were and where they were from. Many times I contacted the ADA and said, what exactly is this chemical that's going into the water? Where is it from? You know, at that stage I already knew, and I had a pretty good idea of what it was, but I got replies like, "Thank you for your comments, Dr. Alexander. Don't bother contacting us again," basically. So now, probably in the last, I don't know, 5 to 8 years, the ADA has actually put on their website the fact that it is hydrofluorosilicic acid is the main chemical being used in Australia to fluoridate the water supply. So there is absolutely no excuse for any dentist out there to say they don't know what it is.
Do you think they'd be shocked if they knew that this was the case?
Yeah, well, I've confronted quite a few dentists and said, do you know, do you realise? And they have acted shocked, but not shocked enough to go away and do anything about it or do much research. And yeah, John Paul Langbroek was somebody I spoke to early on, so he's the opposition leader in Queensland at the moment, who was very much involved in having the bill passed to make fluoride compulsory in Queensland, or fluoridation compulsory in Queensland. And I asked him on numerous occasions, do you know what that is? Do you know where that comes from? He'd look at me with a very bland, dull look on his face, as he's prone to do, and say, oh, look, I'm a politician here, I'm not acting as a dentist, and let's leave that to the water supply managers, shall we? So yeah, that's kind of typical of the ADA response, and he's totally representing the ADA on this one. I have to make that statement.
In dental school, did they train you regarding the systemic toxicology of fluoride?
No, actually, we had one of the leading lights in water fluoridation was the Dean of our children's dentistry at the time, Professor Story, and he was at the time promoting fluoride to treat osteoporosis with absolutely, turns out, no factual matter to back that, no scientific research at all. And I do remember him saying that there's no point giving fluoride tablets to pregnant women because they believe fluoride doesn't cross the placental barrier, which I'd be very surprised if it didn't, and I believe that it does. So that's the kind of, they skirted around a lot of issues. We were just students, we didn't question, we didn't know enough to ask the right questions back then, so it wasn't until you're out there using the product and you're applying it to teeth and kind of crossing your fingers and hoping that these kids with dental decay, their teeth will miraculously get better if you apply topical fluoride, and honestly it didn't work, and that was my experience. In my practice, I couldn't see any difference. I moved to Queensland and I had a 4-month-old daughter, and I was still doing what I was taught to do, recommending fluoride to my patients, and I thought, oh, I better give my daughter some fluoride. You know, she's only little and she needs everything to protect her teeth because Queensland wasn't fluoridated at the time. So she was probably, I don't know, just under 2, and I caught her climbing up onto a cupboard into where the medicines were caught on chairs. she was climbing up on a chair and she had undone the lid of the little fluoride tablet container, and childproof lid, go figure. And anyway, there were little pink tablets spread all over the kitchen floor. She'd gotten down on her hands and knees and was looking like she was consuming some of those, so I panicked a little, pushed them away from her, grabbed some milk and tried to force it down her throat. Started to think, oh my God, do I have to take her to the hospital to get her stomach pumped? What do I have to do? You know, picked up the bottle and this is a poison. What am I doing giving my child a poison to protect her teeth? This does not make sense. And from that day on, I never gave her another fluoride tablet. I never offered fluoride to another patient, and I did my own research. So thank God it turns out that she hadn't consumed anything. She was just playing with them. And you know, that was a major relief, because a few tablets could have killed her, you know.
So I'm just going to go back a slight bit. So in dental school, did they train you regarding systemic toxicology of fluoride?
Not at all.
Not at all.
Nothing.
Did they tell you that industrial grade silica fluorides have never been properly tested for safety in humans?
No, we were never told that.
So how can dental organisations such as the ADA be part of forcing systemic fluoridation on populations when, no offence, dentists are trained to work with the mouth only?
Exactly, and that's an issue in dentistry in itself, that we only focus on one part of the body when what we do affects many parts of the body. That's definitely true of dentists.
According to Dr. Arvid Carlson, a Nobel Prize for Medicine winner, water fluoridation is against science, and nations who still practice it should feel ashamed of themselves. Carlson bases his point of view mainly on the fact that fluoride's mechanism is topical or post-eruptive, that you don't have to swallow it to prevent decay. Carlson continues, quote, "In pharmacology, if the effect is local, it's, of course, absolutely awkward to use it in any other way than as a local treatment. I mean, this is obvious. You have the teeth there, they're available for you, why drink the stuff? I see no reason at all for giving it in any other way than locally or topically, if you wish," unquote. Researchers now clearly acknowledge this. Even the Journal of American Dental Association in the year 2000 said, quote, "Fluoride incorporated during tooth development is insufficient to play a significant role in caries protection," unquote. Therefore, Dr. Alexander, what are your personal views on Australian authorities continuing to force fluoride into public water supplies? Would you agree that this is an illogical, let alone dangerous measure?
Dangerous, number one. Yeah, definitely dangerous. And number two, totally illogical. And as a person who takes vitamin supplements and tries to look after my own health, I would never impose my regimens on anybody else in the population. I take vitamin C every day. I don't want vitamin C in the water. I don't want every age group to get access to vitamin C. Only it should be given as is appropriate for the person and the individual. And that's, you know, fluoride's definitely one of those medications that should be controlled by people who are trained and understand the toxicity of it. Unfortunately, actually that's not even dentists, because they don't understand the toxicity and the dangers of fluoride. They don't know what they're handling, and they don't understand that everything that goes in the mouth is readily absorbed through the mucosa into the body. And you know, that's without the benefit of going through the digestive tract and being filtered out, you know, in the kidneys and detoxed in the liver. When you absorb something through your gums, which is what happens when a dentist applies topical fluoride in the dental chair and says to a child, don't swallow, of course they can't not swallow. They do swallow. They swallow a lot of fluoride in the dental chair, but they're also absorbing fluoride through their gums. And so I personally, I don't think dentists are even equipped to handle that product in their own surgeries, let alone allow it to go into the waterways. Or they need retraining on the whole subject if that's going to continue. I honestly, you look at tetracycline staining in children's teeth. Back in the 60s, it was discovered that tetracycline given to young children, to babies, to pregnant women actually was absorbed and bound with calcium in the teeth and bones and caused irreversible staining of the teeth. Now dentists knew that and accepted that, and so they warned parents, they warned mothers that were pregnant, don't take don't accept tetracycline if you're given that because it could damage your baby's teeth. And they made sure that they never prescribed it for young children because tetracycline staining, if you've seen it, can be a fluorescent discoloration of the teeth. And sometimes actually it's confused with dental fluorosis, but I think a lot of the times it's a combination of both that people are seeing. So in my mind, dentists saw this, they understood, don't give a pregnant woman this drug, don't give it to children, it damages the teeth. How is fluoride any different? Because that's what fluoride does when you ingest it. It damages the teeth and bones.
Dr. Andrew Harms, past president of the Australian Dental Association's South Australian branch, has described dental fluorosis as, quote, a window to the bones, unquote, meaning if you see dental fluorosis, it's the visible manifestation of toxic overexposure to fluoride, and that this means bones have been damaged along with teeth. Dr. Harms is not alone. Dr. Hardy Lineback states, quote, it is illogical to assume that tooth enamel is the only tissue affected by low daily doses of fluoride ingestion, unquote. And Dr. John Colquhoun, a New Zealand dental researcher, states, quote, common sense should tell us that if a poison circulating in a child's body can damage the tooth-forming cells, then other harm is also likely, unquote. Australian authorities dismiss dental fluorosis as just a cosmetic effect. Do you believe that this is an irresponsible position to take whilst Australian children are being toxically overexposed to fluoride?
Totally irresponsible. Totally irresponsible. There are children walking around here. If it was ethical, I'd grab every second child and get them to sit down and smile, and you would see how much dental fluorosis is in this particular community, and you might think, hasn't been fluoridated before. A lot of the families here move from Sydney, they move from Newcastle to here. The children, may have been born and spent the first 6 to 8 years of their life in a fluoridated environment, and that tends to be quite common in Port Macquarie. So my argument is, yes, number one, and I agree with Professor Sheila on this, if there's a child with dental fluorosis, they more than likely have subclinical hypothyroidism, and so they should be checked out for that early on because that needs to be addressed. That's really important. I know that fluoride also has an affinity for the pituitary gland. That is really a really important part of the body. And we're finding out more and more and more as we look into it, the other parts of the body that are affected. And dentists have for too long isolated the mouth and ignored the effect they're having on the rest of the body, from the use of amalgam filling to extracting teeth for orthodontic purposes, to not looking at how the bite affects the rest of the body. They just think, they'd be happy if a set of dentures walked in and they could take the dentures and do their work and pop the dentures back in and send the patient home. And another thing I really want to say is that for years now, dentists have known that dental fluorosis was so common that dental technicians who make crowns and dentures and veneers have incorporated signs of dental fluorosis into these dental prostheses, these crowns and these veneers, to make them look more normal, so that they didn't stand out as being fake. So that's how normal dental fluorosis has become in our society. This has been going on for years. I'm not talking about just the last few years. I'm talking about the last 20 years.